There is a concerted effort in raising awareness on key issues that affect all facets of human existence. One of such strategies is setting a day aside on raising awareness to such important things. Hence, you have a World Cancer Day, World Diabetic Day, AIDS. The list is endless. Pathology is an arm of medicine that deals with human anatomy. Other medical practitioners depend on the diagnosis of a pathologist to know the right medication to treat an ailment. It is not therefore out of place that a day is also set aside to create the desired awareness to the practice and practitioners. The Lagos State arm of the College of Nigerian Pathologists to mark this year Pathology Day with the theme Advances in Rapid and POC Diagnostic Testing, led by the chairperson of the Lagos State branch, the erudite Professor Fatima Abdulkarim. Members, medical students and invited guests converged at the exotic Ibis Hotel on Toyin Street, Ikeja to chart the way forward. Before the opening ceremony, Dr. Adeyemi Dada gave a brief lecture on the theme for the day, which hinged on the use of smartphone devices for diagnosing.
A medical diagnostic test performed outside the clinical laboratory and in close proximity to where the patient is receiving care. So that is POCT. And it's also defined as any test that is performed at a time at which the test results enables a decision to be made and action taken which leads to improved health outcome. But we also need to take a caution here because some have they mistake POCT for waved test. So we need to know that a waved test is different from POCT according to the Clinical Laboratory Improvement Amendment Act 1988. Now, what is a wave test? It's a test that carries low risk of inaccuracy. In other words, if the test is done and it's not accurate, it carries a low risk. So several tests have actually been tagged wave tests. And a number of them, if we go to the Clinical Laboratory Improvement Amendment website, we'll get a list of them, but they are common around us. There are the urine dipstick, pregnancy tests, glucometers, and a host of others. These are waved tests. So if they are inaccurate, it does not carry so much problem. So they are waved. But they are not POCT. But we need to also know that a POCT may be waved or non-waved. So some can be categorized as waved, and some and a good number are categorized as non-waved. So the non-waved ones, they are the ones that are a bit more complex and highly sophisticated. The test is done outside the laboratory. It's done close to the patient. So those are important features that we need to note. And of course, on the other side, we have a list of common POCTs that we have today. The glucometers, the handheld devices for chemistry, for different microbiology, and even hematology today. So we have several of them. Now, there are ID requirements for POCT, and I'll just quickly go through them. And the first thing is that the result must come out in less than a minute. Of course, this may not always be the case. That's one. Now, portable instruments with consumable reagent cartridges. A lot of them use cartridges. The third point is that they are single-step operating protocol. If we look at the routine laboratory, and we have to look at all the testing, analytic testing we do in the lab, they follow a lot of processes. But POCT are actually meant to be single-step operating protocol devices. So it makes it easy to use. But we must also be careful when we say easy to use because we can still get errors in these tests. So we need to take note of that. Now, capability of performing direct specimen analysis on whole blood, CSF urine, and a lot of other biological specimens like stool. Then it should have a simple operating procedure that do not require laboratory-trained operator. That is one other point that we need to note. Flexible test menu. Results must meet analytic specification and must be fit for accuracy, fit for purpose with accuracy and precision compared to what we have in the central lab. It must be built, there must be built-in integration, calibration, and quality control. So for POCTs, we should also talk about quality control. we should talk about calibration. A number of POCT devices that are being used today. Some people have been using their devices for years and they never bother to ask for calibration, neither have they bothered to ask for maintenance. So all this will impinge on the accuracy of that test or the POCT device. So all this needs to be looked into. The ambient temperature storage for reagents. There should be low instrument cost. I'll talk a little bit on this because that is actually what should be the ideal. On some fronts, we've noticed that it's not what obtains. At other fronts, it's something that is feasible. But this is what we should have. And this is what should be available. And there should be built-in regulatory record keeping. Now, according to the WHO, there are benchmarks for identifying appropriate diagnostic tests for resource-constrained settings. And the first thing is that it must be affordable. So POCTs, for them to fit into the benchmark for WHO, they must be affordable. The second is that they must be sensitive in using it. What you are trying to detect, it must pick it. And specificity also. So it must actually, in sensitivity, what we're actually looking at is, if I'm testing for glucose, it doesn't matter the concentration of glucose at that time. It must pick it. Glucose is glucose. It's not going to misinterpret it for ketones or other things. Now, it must be user-friendly. It must have a rapid and robust character. That means it must be rugged. We must be able to use it, and it's not something that will damage so quickly. Equipment free. We don't need too much space to use all these things, and it should be deliverable to end users. This is what the WHO has highlighted as a benchmark for appropriate diagnostic tests. Phases of POCT. In our routine lab, we have 3 phases. That's a pre-analytic phase, analytic phase, and post-analytic phase. Now, this is also very important in dealing with how errors occur in the lab. And it's been said that more than 60 or 70% of errors are actually linked to pre-analytic stage. And that is the process of sample collection. So POCT also has these phases. So selection of proper test method is one under pre-analytic, and specimen collection is another, because you also need specimen for this POCT test. Under the analytic process, we have the process of detecting targeted biological signals and transforming them into measurable signals. That is the analytic phase. And the post-analytic phase, we have data analysis, result display, storage, and transmission before we make our decisions. So all these phases are actually being incorporated into POCTs, or POC diagnostic testing. Where did we start from? It dates back ancient years, in the Egyptian era. They actually started doing things like POCT without knowing. And one of the things that they did, we can trace it back to the ancient Egyptian papyrus document. And it says that a potentially pregnant woman will every day, over several days, urinate on barley seeds and wheat seeds. And after several days, he said that if the two of them grow, she's pregnant. If barley grows, she's going to give birth to a boy. But if wheat grows, it means it's a girl. Now, don't ask me how accurate it is. But they used it over years. So that means to some extent, it worked for them. How it worked, I don't know. I'm not privy to that information because that is a bit of pre-scientific era, but it worked for them. Now, testing of patients' urine for diabetes came in. We have urine dipstick, which was developed in 1957, human pregnancy test in the 1970s, and later other POCT tests, they evolved in the coming years. Now, these are the stages we have in the central lab, from the process of request to collection of sample, Then we now go on to gathering the samples, taking it to the lab. Now, all these have actually been incorporated into POCT. So with POCT, we are able to compress all these steps. And the delays in decision making and management of patients is now gradually being avoided. These disadvantages, they range from increased administrative work associated with training and certification of the operators. Because it's not, just like we know that POCT is easy to use, but it's not everybody that can use all POCTs. There are some POCTs that you need special training for the person that's going to do it. Then increased risk of errors if tests are performed by untrained operators. So these are some of the disadvantages we have seen in the way POCT has fared over time. Now, point of care testing is now everywhere. It's everywhere in healthcare environments and at every stage, from the commencement of emergency care with the paramedics to specialist treatment in acute and critical care units. In the wider community, many GPs, they use it, even in the clinics and even at surgery occasionally or at times. The global point of care testing market forecasted that the growth rate for POCTs between 2013 and 2018 is 9.3%. And in 2018, the market was actually valued at $17,600 million US, and is expected to reach about 36 million by the end of 2015, giving us a growth rate of 9.4%. In North America, they have been the biggest users of POCTs. That's the United States, Canada, and Mexico, followed by Europe, Germany, France, even in the clinics, and even at surgery occasionally or at times. The global point of care testing market forecasted that the growth rate for POCTs between 2013 and 2018 is 9.3%. And in 2018, the market was actually valued at $17,600 million US, and is expected to reach about 36 million by the end of 2015, giving us a growth rate of 9.4%. In North America, they have been the biggest users of POCTs. That's the United States, Canada, and Mexico, followed by Europe, Germany, France, the third, fourth, and the fifth, the rest of the world. I think Nigeria will fall under the rest of the world. Yes. Now, in the US, from 2015 to 2022, by projection, we have seen a gradual increase in the use of POCTs over time. And it involves blood gas testing, hematology, pregnancy and fertility, coagulation, cholesterol. And we can see that consistently it's been increasing. And this will continue to increase with the rapid advances that we have in POCTs now. And we'll get there very shortly. Now, in Nigeria, we have quite a number, but I just brought this, we have these statistics from iStat, the use of iStat, and we have seen that in 2013, we can see the use of the general chemistry test. In 2014, we can see that it has increased. It has increased. This is 2014. 2008, 2009, 2013, and 2014. So gradually, we can see that a number of all these tests are actually they are changing. They are changing over time. And that is just on iStats. But I wasn't able to get statistics on the use and actually the market consumption in Nigeria. But you and I know that gradually is increasing, because in the clinics today we have glucometer in virtually every clinic. We have all the dipsticks all over. So it's also increasing. Now, accreditation matters. We need to also know that in using all this, we need to trace it. We need to trace these POCTs to a lab. We need to trace it when it comes to quality and in terms of quality assurance. So the ISO 2870 in 2006 is directly applicable to POC testing and is conducted in hospitals and ambulatory care, while patient self-testing in the home or community setting is excluded from the standard. But be it as it may, you still have to trace it to the ISO 15189, which is the general standard for the laboratories. So we need to trace it to that. And safe and effective governance of POCT includes responsibility for areas such as selection and validation of equipment use, education and training of users, internal and external quality assurance, maintenance of these POCTs, record keeping of quality and patient data, incident reporting, risk management, clinical audits, and advice as well as interpretation. Where are we with the POCTs? Advances have been made, and these advances have made use of continuous developments in technology. And these developments include biosensors, microfluidic technology, innovations in cell phone-based technologies, paper-based assays, lab-on-chip platforms, and novel assay formats. So all these have actually been compressed. And another one which is common that is not here is nanotechnologies. For biosensors, we need to know that it more or less takes a central stage in the development of these technologies of POCT that we have. Whether it is microfluidics, paper-based, cell phone-based, the biosensors take a central stage for it. And this is actually the process for detection. That's something similar to the picture earlier on. So it's just a full, what we have is once you input the biological fluid or sample, there will be a record emitted into an electrical signal. That is what we're having now. Now, also for biosensor, we can have enzyme-based, tissue-based, immunosensor-based, DNA biosensors, thermal and piezoelectric biosensors. So it can be used in every field of pathology. Microbiology, histopathology. So it can be used everywhere now. Now, this is an example of an Eversense XL implantable glucose sensor. All you need to do is attach it to the abdomen. By Bluetooth, you get your reading. Glucose levels in the blood, in the interstitial fluid, will show on your cell phone. The microfluidics is one of those ones that are a bit more complex. And all it takes is, but it's not so much, it's a science and technology that deals with small amounts of fluidics. And nanotechnology will also fall in this category because what happens is a number of our analytic processes now, they have been miniaturized such that we now have things in the optical field. We have nano materials, nano-optical materials, magnetic materials, such that by the time a sample is introduced into a chip, all you need to do is just put the chip inside the device and you get your reading. So it can be done easily in the clinic, by the bedside, and you can move on with that. So that's microfluidics. Even immunoassay, the routine immunoassay we do, can actually be done using nanotechnology. Nanotechnology can be used in microbiology in diagnosis of infectious diseases, and it can be used in chemistry, it can be used in hormones, all over. Cell phone-based technologies. In cell phone-based technologies, it promises to be one of the largest that we'll have very soon because more than 70% of, or more than 7.4 billion people have cell phones in the world today. And it's been said that more than 70% of the more than 7.4 billion are in the developing countries. And that this is the area, this is the place where we need POCTs more. And the truth is very simple. Everybody in this room has a cell phone. So if you all have cell phones, very soon, in your house, you use your cell phone to make diagnosis for yourself. Then you call the doctor, come and treat me. All right. Now, these are other examples of smartphone devices. Now, the truth is, POCT is moving on. And with the use of miniaturized technology and our cell phones, we can do a lot more. We can do a lot more. Now, the question now is, where are we going next? We can see the advances. Where are we going next? I know that, well, cell phones are actually moving on now. We have phones on your wristwatch. We have phones everywhere. So very soon, you won't even need cell phone. There will be something else. I don't know that. She'll just keep our fingers crossed. But I know that these drivers are actually moving on with a lot of advances. And that is with companies like Roche, like Abbott, like Siemens, Johnson, Nova, and Abaxis. They are doing a lot of work on POCTs. And on this note, I want to say thank you for listening.
After a brief introduction of the chairman, keynote speakers, and others to the eye table by the event coordinator, Dr. Ola Akinsoya, the event started in earnest with the rendition of the national prayer, which was followed with the remarks by the LOC chairman, Dr. Sam Keshinro.
It is my pleasure to welcome you to the 2019 International Pathology Day event. This is the second one being organized by the College of Nigerian Pathologists. Lagos, to acknowledge and laboratory medicine services and Nigeria in particular. This is also an avenue to create and laboratory, especially students, and ultimately to encourage them to pursue specialty as a career. For the benefit of non-medical practitioners present, pathology is not only the study of diseases as the great disease study, but a book of science and medicine addresses 4 components: disease, the mechanism of development, the structural changes, the consequences. That's the clinical effect that regular doctors see. In Nigeria, medical specialty include 4 major groups of specialist doctors: the clinical pathologist, clinical microbiologist, hematologist, and anatomical pathologist. Advances in rapid point-of-care diagnostic testing, as discussed by Dr. Dada, encompasses instruments and techniques that will enhance easy-to-interpret bedside investigations to aid patient care. The possibilities herein can only be imagined, as you must have seen earlier, and as heavily on accurate pathology services. That is the results and interpretations. We are not also unmindful of the challenges facing our profession. Therefore, our keynote speaker and a senior member of the profession, Dr. Funmilayo Olatunji, will be discussing the bane of medical practice in Nigeria, the pathologist's perspective, as the program progresses. At this juncture, I would like to appreciate my team, members of the organizing committee, for working tirelessly to make this event a reality, just as the pathology department works daily around the clock to ensure correct diagnosis and collaborate in multidisciplinary teams for optimal patient management. They have actually imbibed the spirit of pathology. Namely, Dr. Adeyemi Dada, Dr. Festus Emiogun, Dr. Ola Akinsoya, Dr. Mario Adelaja, Dr. Kila. They have actually been members of the LOC and they have worked tirelessly. Please help me give them a round of applause. A very big thank you to the chairperson, College of Nigerian Pathologists, Lagos branch, Professor F.B. Abdulkarim, and the rest of our executives for the confidence reposed in me to organize this year's program. Once again, distinguished guests, colleagues, ladies and gentlemen, you are welcome. Kindly sit back, relax, and enjoy the rest of the day. Happy International Pathology Day to you all.
In our welcome address, the chairman of Lagos State branch of the College of Nigerian Pathologists, Professor Fatima Abdulkarim, described pathology as the bedrock of medicine.
It is a great honor to be here today celebrating International Pathology Day, which is celebrated annually to create awareness on the role of pathology in the healthcare. This event taking place here today is aimed at educating members of the public, to educate members of the public on who pathologists are, what do they do, how essential are the services that they render. It is also aimed at encouraging students, and that's why we have quite a number of you here today, to take up careers in the field of pathology, as well as discourage brain drain in pathology. Like the chairman LOC already adduced to, pathology is the bedrock of medicine, and this is a specialty that is concerned with the study of diseases, the causes and mechanisms that result in illnesses. A pathologist is one who, after 6 years of undergraduate study in the university, spends another 6 years minimum of postgraduate training in laboratory medicine to specialize in pathology. And as already said, there are 4 major subspecialties in pathology: anatomic pathology, hematology, microbiology, and chemical pathology. Anatomic pathology looks at the body tissues to make diagnosis, such as when you have a breast lump, that the pathologists we have to look at to determine whether it's cancerous or not, or such as when a pathologist will need to carry out post-mortem examination to determine the cause of death. And a microbiologist studies microorganisms that cause disease. He does not just study them, makes diagnoses when there are illness, and also prescribes what is appropriate for the treatment of such illness. But the chemical pathologist looks at the biochemical components of the blood when they become abnormal and determine what disease they are causing, and also prescribes what kind of treatment that should be given. And the hematologist, on the other hand, looks at the blood and its components to make diagnoses and also treat diseases of the blood. The pathologist, therefore, is first and foremost a physician before now becoming an expert in laboratory medicine. He or she is described as the doctor of doctors, because other doctors will have to consult him in the management, not only in diagnosis, but in management of the patient. Even after management and the patient gets well, you still need to follow up the patient. The pathologist will still need to be needed in order to follow up the patient, whether there is recurrence of disease, or whether the patient has fully recovered, or whether other complications are likely to erupt. And so, when you send any request to the laboratory, every request that goes to the laboratory are consultations to the doctor in the lab. And who is that doctor in the lab? It is the pathologist. So apart from quality assurance and quality control, prompt diagnosis is essential to promote early treatment and reduce mortality and morbidity. For instance, in many developing countries such as Nigeria, in which increasing incidents of cancer have been reported, higher mortality has been attributed to delay in diagnosis, and limited access to pathology diagnostic services, among other reasons. Early detection and accurate diagnosis made in a very cost-effective manner is known to be the key to reducing cancer mortality. Hence, the theme for this year, Point of Care Diagnostics, is aimed at developing devices that are easy to use, affordable, increased durability, and robust that be used to make diagnosis in a prompt manner such that the turnaround time, as already alluded to by our earlier speaker, Dr. Dada, will be shortened. In today's world, technology and medicine work together to make diagnosis at the bedside or in the clinic, thus ensuring prompt treatment and reduce mortality and morbidity. The College of Nigerian Pathology, Lagos State Branch, is therefore commemorating this day, this International Pathology Day, discussing recent advances in laboratory practice with a view to improving laboratory services to the populace, with a view to improving laboratory services to the populace. In addition to this, we want to use this medium to achieve 3 other things. 1, to educate the citizenry to desist from going to request for laboratory tests without first consulting their doctors. 2, encourage students to take interest in pathology in order to reduce the shortage of pathologists, because we know that even in Nigeria, the ratio of pathology to the populace is more than 1 to 1 million.
In our opening remarks, the chairman of the occasion, Major General Tilewa Amosun, retired, thanked the organizer for giving her the opportunity to serve and emphasized on the need for proper health administration.
Let's be ready to listen, and let's know that what we're going to get would only further give us the impetus to work towards letting people know that aside from working or looking at what is happening on the bench, as pathologists, we have a bigger role to make sure people know what we're doing and also to be good managers, because pathology should set the pace of medicine. So thank you very much, Dr. Latunji, for accepting to give the keynote address. And I'm sure that our potential pathologists, that's the medical student, for every medical student who is here today, I don't think I should say some of you will be pathologists. I am expecting that all of you will be pathologists. Pathology is the specialization of the future. You will never be out of job. So never mind that now there might be some things that you feel that, oh, you don't want to. By God's grace, by the time you're ready, most of these things will be straightened out, and you will find that pathology is the specialization of the future. So please make sure you listen well, and you're able to derive the benefit from it. So I hope today we'll all be able to have a good time. I thank you, everyone, for coming. And, of course, I thank the chairman and the LOC for the honor given me.
The goodwill messages were led by the #1 medical doctor in Nigeria, the NMA president, who is also a pathologist.
I must congratulate the current chairperson and members of CNP Lagos State for bringing this up. Last year was the first time that we had a very great celebration of International Pathology Day, and Lagos did very well. I was in Abuja, I joined them at Abuja, but Lagos also was very active. And I'm happy to be here with you today as we are doing this second one that we are celebrating. I congratulate all of us. However, apart from letting younger people to come to pathology, there are some important things that we pathologists must be able to talk to ourselves. Number 1, we cannot achieve success only by being professional and working in the laboratory. To achieve success in Nigeria, we have to go beyond our laboratory. That is the area that we are not doing very well. We need to reach out to our colleagues. I'm happy we have a medical director here. But I can tell you, most of the medical directors do not appreciate what pathologists do in their different hospitals. That is the first place. And we must be ready to change the narrative. Until we do that, we'll continue to be like second rate. And actually, pathology is supposed to be the center point of all diagnostic, all management, all treatment within the health sector. The second one, if you call other group, either gynecologists, orthopedic surgeon, and other specialty, by the time you see them, especially Sogon, if you see them, they are very powerful, not because of people who are working in the private sector. It is majorly because of people who are working in the private sector. They have that fund. They have that ability to attract other people to come. I think pathologists need to seriously look into it and see how we can strengthen ourselves in the private sector. We need business pathologists. That is the underlying thing. Unfortunately, in our business pathologists today, we are shortchanging ourselves. We are now becoming employers of businessmen. That will not do pathologists any good. I have advised earlier that we need to all come together, form big company that has the muscle to be able to challenge any other bigger corporation within this Nigerian landscape. Our continuous being employed will not help us as pathologists. I think it is important for us to see how we can all come together. If we have to loan ourselves, if we have to get our loan, if we have to task ourselves, so that we can go out to the field and go and challenge that field. We are the group of people who can make that change for us. Surgeons will not do it. Physicians will not do it. Any other specialty will not do it. I want to assure our younger colleagues who we are hoping they will join us. Pathology is the science of medicine. Any other thing is more or less art. Pathology is the one that will explain how, why, the process, and you can see how the thing became evolved. And pathologists can also explain how those drugs that you use can actually make those changes. I want to encourage you, you will not regret it. Pathologists will make you more will give you more in-depth about human life, and certainly in achieving day-to-day things, I can assure you, you see that you are better off than others.
The citation of the keynote speaker was read by Dr. Nosimot Davis.
Mrs. Olufumilayo Olatunji was appointed permanent secretary in the Lagos State Civil Service in the year 2005 and deployed to the Lagos State Health Service Commission, where she was given the responsibilities of overseeing the human resources for health in all secondary health care facilities in Lagos State. She midwifed the transition of the Lagos State Health Management Board to what is known today as the Lagos State Health Service Commission. With a focus on equitable distribution of human resources for health, the appropriate training and application to their skill to provide quality health care service. She initiated and encouraged the startup of some training programs to achieve the goals. Some of which of these programs are the training of middle and anesthetic manpower for the challenges of inadequate anesthetics in public hospitals, the residency training program in obstetrics and gynecology at the Lagos Highland Maternity Hospital, the family medicine residency training program at the General Hospital Lagos to improve the service delivery and ensure provision of quality health care. He became the head of Department of Hematology and Blood Transfusion in 1996 and proceeds to the settling up of the Lagos State Blood Transfusion Service to coordinate and ensure provision of safe blood for the citizens of Lagos State, upon which there was approval stated for the centralization of blood transfusion services in Lagos State in 1997. This is in order to ensure the sustainable and initiative she proposed and ensure the legislation of the Lagos State Blood Transfusion Service, and this leads to the passing into law the Lagos State Blood Transfusion Service in June 2004.
In her speech, Dr. Fiat Oluwafunmilayo Olatunji, former permanent secretary, Lagos State Health Service Commission, raised some pertinent issues in the practice of medical practice with focus on pathology. They include maternal deaths, brain drain, inadequate equipment, amongst others.
I thought about what to talk about at today's lecture, and I realized the fact that we have this problem, which we cannot run away from it, and it was necessary that we find some solution or some ways of trying to address it. And that was how I came about my topic, which sounded not too pleasant to some people, and I've had to ask even some junior doctors. I'll quickly go through my talk, but in starting the talk, I would want to first address the issue of health in Nigeria. So the outline of my discussion today will be, I'll give you a brief introduction. I'll talk about, give you some background information. I'll give you some general causes, what I call general causes of the bane of medical practice in Nigeria. This is just to show us the life expectancy at birth. You can see where we are. That's at about, if you look at the color, it comes to about 53.7 to 59.84. That's looking at the child mortality in 2016. That is where Nigeria is. I think we can all see where we are there. So Nigeria also accounts for some of the worst health burden of maternal deaths. We are just next to India. In some of these things, you find out Nigeria, India, Pakistan, and all the likes are just neighbors, which shouldn't be. Yes, it shouldn't be, but that is what it is. According to WHO, good leadership and governance forms the central component upon which other components are built in the health system framework. But when we have poor leadership and governance, definitely we are likely to have problems with our health system. Our findings have shown lack of political will at the federal level, at the state level, and even at the local government level for anything pertaining to healthcare delivery. Lack of confidence in the existing healthcare services. Our populace, our people no longer have confidence in the services that we provide. And I think that's why most times now you find somebody who is sick going to patronize either the pharmacy or going to the lab or some of those other people. The quacks are now having a field day. Many government officials travel out for medical treatment due to lack of needed equipment. Our own hospitals do not have what we need to provide the care. And because of that, a lot of the people that are in government are also not sure of what to get, so they leave. Inadequate funding of the sector. The budgetary allocation to the sector, we all know, is usually below the WHO recommended. Sometimes, even the ones that is budgeted is not released. They will tell you there's paucity of funds, so you don't even get it. Then you have the ones that are released, you have its improper utilization. And in many cases, only a fraction of the allocated fund gets used for the purpose for which it is meant, due to what we all know as widespread cases of corrupt practices. Inadequate equipment and infrastructure. We have lack of potable water, irregular power supply in all states of the Federation, and this has adversely affected the health sector You find people drinking pure water. You want to ask, how pure is this pure water? And that is what is happening everywhere. There are no pipe-borne waters, and people now resort to self-help. Lack of oxygen in emergency rooms, non-functioning theaters. These are common problems that we find in our health facilities. Even in the lab, you don't have the reagents, you don't have the equipment, and this surely will contribute to the poor diagnosis of diseases and eventually poor management. In the pharmacies, there used to be no drugs. Some of the hospitals now decided to go into public-private partnership in order to ensure that at least there are some drugs available in the hospitals. But even then, the very poor might not be able to afford some of these drugs when they patronize us. Then we talk about poor remuneration and welfare. Irregular and non-payment of salaries in some states. As we speak, there are still some states that are yet to pay fully the salaries of their workers. And you have discrepancies. What is paid at the federal level is different from what they pay at the state level. It's different from what they pay at the local government level. And we have said before, you have a lot of people leaving the country, so you have increased pressure on the few doctors that are available within the sector. Then we have the intraprofessional leadership crisis, the power tussle, even among doctors, over headship position, backbiting, blackmail, the pull him down syndrome. It's very common nowadays. You want to pull the others down so that you will get there. You have cases of delayed promotion, which demotivates doctors and other health workers. And even those who are putting in extra effort, the efforts are not recognized by senior colleagues. We have some are favored, some are allowed to go, some are allowed not to come to work, while some, so you get queries for not going. And this will result in uncoordinated care of patients. And the big one, the interprofessional conflicts. You have the unhealthy rivalry among different professional groups, doctors and Johesu. And that is where my chairman will come in, because I saw that he was trying at the point in time to have meetings with Johesu and to try and see how they can reach a compromise in ensuring an amicable existence within the health sector. We have the pathologist and the laboratory scientist, the ophthalmologist and optometrist, the radiologist and the radiographers. These are some of the problems. For as long as people working within these sectors are fighting among themselves, there's no way they can give good health care to the people. We have challenges in medical training. You have inadequate trainers, poorly structured internship programs for newly qualified doctors. As I speak, there are so many of young doctors who have finished, who are looking for where to do their housemanship. And I recall that some years back, it was mandatory that if you train people, you should have spaces for them to at least do their housemanship. So what is happening now? Nothing is being done. Nobody is trying to ensure that that is done. So when you find doctors who have finished 2-3 years ago and they cannot do their housemanship, talk less of being able to go for their NYSC. So you end up with demotivated doctors. Poorly structured residency programs, you have inadequate exposure to foreign training opportunity and capacity building. This used to be the case, but right now, it is no longer happening. You have high failure rate in postgraduate examinations, and I think our examiners will also need to look at it and see how they can better improve on the training so that at least we minimize that. And then the high cost of postgraduate examination. Then inadequate mentoring by senior colleagues. A lot of our senior colleagues nowadays don't even come to work. Yes. They have no time for the junior ones. They are not there to guide the junior doctors. And this will result in defensive practice. The junior doctor now make sure they give you treatment for every complaint that you give without proper investigation because there is no adequate supervision. Lack of professionalism. It's really bad that nowadays you find doctors collecting tips, collecting bribes from patients, doctors conniving with other health workers to get something before they can provide treatment for patients. Change in value system. People don't go to work. You find the consultants are not there, or sometimes they are late to work. disrespect to patients. The way some of the health workers, they talk to patients, makes them feel that, they make the patient feel that, look, I would rather go to the herbalist than come to your hospitals. These are some of the complaints from people when you ask why they patronize the other workers within the health sector that are non-doctors. Then we all know about inadequate distribution of health workers. There are inadequate amenities in rural settlements. So a lot of people prefer to work in the urban setting. And because of that, you don't have people in the rural areas. Many doctors and health workers, they don't want to work or stay in rural settings. You have migration outside the country, and you have migration outside of the rural areas. And you also have migration of health workers, more lucrative careers. Some of them leave the practice of medicine for other areas. So now the big question, I think that's what we've all been waiting for. But I'm there to give you a background of some of the problems that we have. So who is a pathologist? What is their role within the health sector? Who defines their roles and responsibilities? And in order for me to find answer to some of these questions, I had to go and check what happens to pathologists outside of Nigeria. What do they do? Where do they work? Within which framework are they? Are they working in the wards or are they working in the lab? So from the Australasia perspective, a pathologist are medical specialists who have considerable skills which enable them to contribute significantly to the provision of high quality, efficient, and effective healthcare. The definition is from the Royal College of Pathologists of Australasia. From their perspective, that is who a pathologist is. They now went further to say the skills they develop as a consequence of their training, first as a medical practitioner, and then as a specialist pathologist, allows them to understand clinical disease processes, diagnostic methods, and gives them the specialized ability to report diagnostic tests. They are usually legally responsible for the quality and accreditation of the laboratory and the results provided by the lab. I want us to note some of those points because I'm going to dwell on the fact that the Australasia pathologists had to come up with a position paper which was adopted and approved by government to enable them to practice pathology as it should be practiced. From the Australasia perspective, the Royal College of Pathologists of Australasia has developed the position statement in order to provide information to healthcare providers, pathology trainees, government administrative bodies, and the broader community on the skill and role of pathologists. The pathologist has the ultimate responsibility for the test results, the quality and safety standards of the laboratory, advising clinician on the interpretation and further investigation of the patient. All what I'm giving you are the points that were developed by the Royal College of Pathologists of that country as to let government, let the community, and let trainers know what are the roles of pathology. They went further to say that a pathologist is an expert, as he has the expertise in the area of practice. They dwell on the 4 different areas that my colleagues have spoken about earlier on, so I don't see the need to go over that. They see a pathologist as a communicator because he communicates with clinicians when they are treating patients. They see a pathologist as a collaborator that consults with other medical practitioners and contributes effectively to patient management. They see a pathologist as a manager that supervises and manages the laboratory effectively and provides clinical direction. And they see a pathologist as a professional that should deliver the highest quality service with honesty and integrity. And ultimately, they say no other member of laboratory staff have the breadth of training on clinical experience equivalent to that of a pathologist. And I went further to look from the UK perspective. Who is a pathologist? So they went to tell us that Royal College of Pathologists is the study of disease. It is the bridge between science and medicine. It underpins every aspect of patient care, from diagnostic testing and treatment advice to using cutting-edge genetic technologies and preventing disease. Doctors and scientists working in pathology are experts in illness and disease. They use their expertise to support every aspect of healthcare, from guiding doctors on the right way to treat common diseases, to bring in cutting-edge genetic technologies to treat patients with life-threatening conditions. They went further to say, pathologists play a critical role in research, advancing medicine, and devising new treatments to fight viruses, infections, and diseases like cancer. Kate colleagues in the use and limitations of each diagnostic investigation. They work alongside health scientists while they complete laboratory. Still from the UK perspective, they believe that a team of medical staff made of pathologists who are either doctors with specialist laboratory training or scientists with specialist clinical training, as well as medical scientists and support staff are the people. I want us to look at that from their own perspective. Who are the people that work in pathology department? It's a team of medical staff made up of pathologists who are either doctors with specialist laboratory training or scientists with specialist clinical training, as well as biomedical scientists and support staff. So here they have included specialist clinical consultants, which is what they call them, as part of people that have the right to work in the pathology lab. You see, doctors, surgeons, nurses, and other medical staff look up to pathologists and consultant clinical scientists. So they seem to give consultant clinical scientists and pathologists the same rating in UK. So that is in UK. That is their own perspective. And then I went further to look at what operates in Canada. So from the Canadian perspective, they believe that pathologists must be involved in the technical aspect of the laboratory operation to properly assume final responsibility as the laboratory physician. The depth of involvement must be sufficient to ensure reliable results, which depend also on the presence of a well-trained chief technologists and technologists who carefully follow the instruction of the laboratory physician as defined in the contractual agreement. That is from the Canadian perspective. They recognize the fact that they don't have enough laboratory physicians. And they went for the inadequate number and maldistribution of physicians. Many laboratories have no on-site laboratory physician, but contractual agreements acceptable to regulatory bodies, mark that word, regulatory bodies, have been negotiated to allow for visiting laboratory physician whose duty it is to ensure, adopt, and implement acceptable standard of practice. So despite the time limitation of a visiting pathologist, it is essential in areas where access to pathologists is difficult that these medical specialist services be provided for the diagnosis, treatment, and monitoring of disease. You will see that their own perspective is also, it has its own peculiarity. Now, to the Indian perspective. This paper, or the Tribune, was generated in India. And there, the Medical Council of India was informing the National Accreditation Board for Testing and Calibration Laboratories that laboratory technician, PhD holder, or scientists are not authorized to sign laboratory results. that only persons registered with Medical Council of India can sign such reports. The decision was taken by MCI and it was communicated to the Ministry of Health and Family Welfare. This was seen as a landmark decision and a paradigm shift in the policy. And the clinical establishment, which is the central government rules, makes it mandatory that all diagnostic laboratories should have doctors registered with MCI or State Medical Council to do the signing of laboratory tests. The scientists, through the association, have protested and written to the minister, but all has been in vain. They have insisted on. So now, what then is the role of pathologists in Nigeria? Within which area of medicine are they supposed to operate? Are they meant to be in the laboratory or they should be in the ward? What are the problems that we are facing in Nigeria? I will give some of the causes that I was able to identify. Structurally, Medical and Dental Council and none other regulatory body or registered, not any association of pathologists or the MDCN or the National Postgraduate Medical or anybody have been able to define precisely the role of the pathologist. So interdisciplinary and interprofessional fields have stalled the growth and expansion of pathology. So back in the 80s, there were inadequate number of pathologists. Inducement allowance was given for you to study in some areas that were identified as rare specialty, ENT, and some others. And this was due to, then the efforts of many trained and qualified pathologists out of the country have contributed to continuous shortage in an area of medicine where there is inadequate number. I said the substitutes, because when there were inadequate number of pathologists, laboratory technologies, as they were formerly known and called, were used as substitute to bridge the gap and other establishments, thus creating the illusion that pathologists are not really needed within the health sector. Then the attitude of our people. Over the years, the scarcity of pathologists, the laboratory work to a large extent was left in the control of laboratory technologists, with doctors just coming at the end of the day to sign. And then the laboratory technologists then saw themselves as the ones in charge of the lab. Grappling and steps to change the situation from having to take orders from physicians have been long in the pipeline, as the laboratory technologists believed were not making any contribution to the work in the lab. Then came the revolt. The initial revolt came with the review of the training curriculum, leading to the attainment of the Bachelor of Science in Medical Laboratory Science, from technologists to scientists. And some of us will recall that at the initial stage, only very few universities were offering the course. I think this is the mandate we have been talking about. The Medical Laboratory Science Council of Nigeria is a federal government agency, and it was established by Act 11 of 2003. And its functions, as contained in Section 4 of Act 2, include to regulate the practice of medical laboratory science in Nigeria, to determine the standard of knowledge and skill to be attained by persons seeking to become laboratory scientists, to regulate the training of scientists, technicians, and assistants, to regulate the production, importation, sales, and stocking of diagnostic reagents and chemicals, and to inspect, regulate, and accredit medical laboratories. You will see now they have coined in the fact that as Medical Laboratory Science Council, they have that right to inspect, regulate, and accredit medical laboratories, whether it is owned or it is being supervised by a pathologist or not. It is blank. And I think that is part of the bone of contention. Part of their mandate is that all premises for the practice of medical laboratory science shall operate with knowledge and backing of the council, that is their own council, and be fully registered with the council for such purpose. And they went further to say that the medical laboratories, whether government-owned or private, shall be headed by a medical laboratory scientist, and that a copy of the current license to practice shall be displayed in a conspicuous area in the business premises. Now, talking about the regulatory bodies. The MDCN Act of 2022 sections, and it dealt extensively on the practice of medicine. It talked about the constituents of the council, our own College of Pathologists website, provided some information on our aims and objectives. But it didn't do as much as providing information on who we are as pathologists. What are our roles in the Nigerian health sector? Its motto, Nigeria's health depends on its clinical laboratories, is well reflected. However, we need to appreciate the effort of this executive and the extent they have gone in bringing pathologists to the limelight in Lagos State. So what is the way forward? There are some areas in need of urgent action at the moment. And the first is pathologists need to define their role and responsibilities within the Nigerian health sector. If nobody is going to help you to define your role, and even those who have registered you to practice have not given you any specific role and responsibility within the health framework, then it dawns on us, it is our responsibility, as other countries' associations have done. I believe it is now our responsibility to define our roles and responsibilities within the health sector of our country based on the training that we have acquired as pathologists. There's also need to bridge the information gap. There's need for massive, sustained education of government, because it seems even government does not seem to understand the difference between the laboratory scientists and the pathologists. So we need to educate government at all levels. Like the chairman was saying, even some of the medical directors have no clue. Once the laboratory scientists are there and they give them all it takes to go along with running the lab, they need to have proper education as to who should do what within the context of the laboratory. There's need for advocacy on ways to address the acute shortage of pathologists in the country. The issue of 500 pathologists, as reported by the CNP national chairman early this year, shows that the issue calls for emergency response action. There's no way you can have 500 pathologists to take care of over 200 million people. It's not possible. Monetary motivation may not be the only answer. Yes, I talked about inducement in the 80s. That used to be the pattern. But now they need to go beyond that. There's need to reactivate the foreign training as an incentive to the young doctors. There's need for modernization and equipping of the laboratories. Some of our laboratories have very dilapidated and old equipment. There's need for provision of needed tools to work in the lab. There's need to entice new people to be able to work in the lab. There's need to redefine the setup so that clinicians can be accommodated as supervisors within our laboratories. And now, the big one, the laws. There's need to form a pressure group to work on the review and amendment of existing laws. But this can only be done if we're able to define our own roles and present it for acceptance, adoption, and approval by government. If government is able to agree with us on what should be our own role based on the training that we have had, then there should be no problem trying to work on amending the existing laws. Because as it is, some of the laws are infringing on the roles of other practitioners. Like some of the laws of the that had been approved for the medical laboratory scientists, that is in the Medical Lab Scientists Act, is already infringing on the roles that are meant to be taken care of by the pathologists. And the review of laws is solely the responsibility of Medical Laboratory Science Council, and MDCN, and perhaps the National Postgraduate Medical College. And they are all organs of federal government, and they are all supervised by the Federal Ministry. Important things that we need to do. We need to show more commitment. We need to be able to mentor the junior ones and bring them up to the level such that we would be proud of the system that we are operating. I was speaking with the chairperson of this occasion, and well, it might be a joke, but it's not really a joke. It might come to a that there are no efficient, good, responsible doctors to see us in our old age. If we continue the way we are going, very soon you won't have enough good doctors to attend to you. And we need to work at amending it now. We need to look at ways by which we can change the trend. An encompassing stakeholders consultative forum in the Nigerian health sector with periodic review meetings remain very, very essential. For the specific causes, the pathologists in Nigeria need to define their coverage within the health system and establish guidelines on it. And this can be done by CNP. Our association can start that. There is need for sustained effort to ensure the endorsement and approval of such guidelines once you have your position statement as to who you are, and then you can now get this position paper across for endorsement and approval by the State Ministry of Health and the Federal Ministry of Health. And the approved guidelines of operation must be circulated among the public for their awareness. We all need to work hard to achieve this so as to ensure the sustenance of our profession and to encourage more young doctors to join the profession. I thank you all very much.
The event also created a platform to honor deserving members.
The member of the American Society of Hematologists, ASH, member of Nigerian Society of Hematologists, Transfusion, member of the College of Nigerian Pathology, CNP, member of Medical and Dental Consultants Association of Nigeria, MDCAN. Dr. Olaya retired from public service in 2019 after attaining the statutory retirement age. Please, ladies and gentlemen, kindly join me with a round of applause in welcoming Dr. Olaya Modipe Adebinke.
Of Nigerian pathologists, I want to present to you this plaque as a sign of your dedication, a sign of your commitment to duty and to the support that you provided to the association while you were the executive secretary of the Lagos State Blood Transfusion Service. And we want to wish you the very best in all your future endeavors. Congratulations.
Dr. Fajile is a proud indigene of Ikoya in Okitipukupa, local government area of Ondo State, and the first son of the present Abode of Ikale land, His Royal Highness Oba GB Fajile Adegmutu. As a prince, he grew under an atmosphere of strict cultural, moral, and social tutelage. And as a son of parents who are both educationists, he was trained to imbibe discipline and diligence as the only means for achieving success in life. He weaved into his personality, honesty, dedication to duty, and fear of God to make him a dependable and trustworthy man. He owes his brilliance in career. He owes his brilliant success in career and other endeavors through thorough breeding, discipline, focus, and dedication to duties, which are his cardinal principles of success. He started his post-secondary school education at the College of Medicine, University of Lagos, where he obtained his MBBS. And after then, he has gone forward to achieve several educational and professional qualifications, including being a fellow of the Medical College of Pathologists of the Nigerian Postgraduate Medical College of Nigeria, and a fellow of Pathologists of the East Central and Southern Africa of the East Central and Southern African College of Health Sciences. He also has an MBA degree, a master's in cell biology and genetics, diploma in National Cancer Institute Division, of Cancer Prevention in USA, and also from Forensic Human Identification, Faculty of Forensic and Legal Medicine of Royal College of the Physicians. He is an erudite scholar, academic, and administrator, and has served at various positions, including being the HOD one time at his Department of Pathology and Forensic Medicine, Lasuti Keja.
Also honored to present to the President, Nigerian Medical Association, our own Professor Francis Adedayo Fadrile, and many other things, Lola. So thank you
for your commitment to the College of Pathologists of Nigeria, despite the fact that you have many more things on your plate, and to show our appreciation that you continue to remember your family here. And I know that we'll continue to count on you, particularly after the lecture we have just heard. There's a lot that I know that the NMA will have to support the pathologists to be able to achieve. So thank you very much, and we hope that this will have a place of pride in your office as NMA president for now, so that when people come in, they will know that you have the backing of your family. Thank you very much.
Dr. Chris Onalo gave the vote of thanks to transit to the breakout session, where pertinent issues were appraised and discussed.
We want to thank every one of us that is here, our senior pathologists, medical students, other health practitioners here. It has been a very exciting day. We hope to have another one by next year, by God's grace. Thank you very much for coming, and God bless.
The impression has again brought to the fore that the important role that pathologists has to play in the healthcare system. And today's being the International Pathologist Day has been to fore on what pathologists need to put in place to improve the health system, being on rapid testing and recent advancements that we have seen. And I'm happy that our people in Lagos State were able to come together and be able to host this, educate the public, talk to the students, and people getting better awareness of what pathologists' role is in the health sector. Well, there are so many things that can cause wrong diagnosis. Many of them can be pre-analytical, it can be during the analysis or post-analytical. But the most important one that we want to discuss is the one that is during the analytical period. And in getting this done, it can be as a result of the machineries, the equipments in place. If it's not properly, if it's not updated, it is not up to date. And also, it can be on some level of knowledge of those people who are working on those equipments. So we really need to work together in this country so that we can improve the knowledge of our people and also have harmony amongst the health workers so that we can improve the results that are coming out from our laboratory.
It was number one. I have to thank the EXCO for giving me the opportunity to serve and be the chairman of the LOC. It wasn't an easy task, but as I've mentioned earlier in my speech, that the pathology team, they always work around with us, so we are used to it. So when the situation and the opportunity arose, we had to do what we have to do, make sure it comes to fruition, and this is where we are now. The major part of what the guest lecturer actually made is policy making, because without policies, we can't go ahead. So as a society, as an association, what we intend to do after this, at the breakout session at the meeting, is actually form small committees where we can have policies concerning pathology practice in Nigeria, and we give the government, we advise the government about what we need, what is needed to be done.
Oh, fulfilled and happy that we planned it and it's been successful. We're going to take it further, and immediately now we're breaking out into 3 sessions where we're going to address issues that have been raised in the lecture, particularly issues relating to, the pathologists exactly what are their roles, how do we get, proper policy that, the government, that will be acceptable to the government and the populace, and that we address especially the issues of disharmony among professionals in the laboratory, issues of accreditation, and also issues of retention of pathologists that we train in Nigeria. We spend so much money as a country that we have shortage already. We train, and then those that we train go to countries that already have enough. It is a very sad situation. So some of these issues we're going to start right away. We're breaking out into sessions. We're going to talk about some of them and see how we can take them further.
I've learned a lot from the lecture of today. I learned from the major lecture of today that a lot needs to be done, especially in the relationship of our senior doctors to we the junior ones that are upcoming, that they need to mentor us and not leave us behind. During the lecture, she mentioned the fact that we have little of mentorship these days in medicine. So it leaves the junior ones without experience, without knowledge. So I learned that also myself.
From what the former permanent secretary had said, I actually realized that there's a lot of work that needs to be done, not just for pathologists general, but in the health sector. So in certain places where certain sciences, pure sciences, actually make certain rules that actually affect us as medical practitioners, and also in our relationship with them, and also in the implementation of these rules. So that's really the part where I actually took out from, where certain adjustments need to be made, so we could actually have a peaceful environment working.
The lecture is mainly to educate the public, and also for the pathologists also to be able to define their role within the health sector. As it is, there's a lot of crisis when it comes to laboratory medicine in Nigeria, and for us to have the proper diagnosis, proper treatment of infection, then there must be clarity as to the roles of each of the teams within the laboratory system. In the lab, as I said, you have a lot of people working. You have the pathologists, you have the laboratory scientists, and you have all the laboratory technicians and assistants. But if you do not have clearly defined roles for each of these groups, then there is going to be intrusion, and ultimately it's the patient that will suffer. Because where you don't have harmony within people working together, invariably the patient will not get the best. And that is precisely what I was trying to say. In Nigeria, there is need for the regulatory body to be able to clearly define the roles of each of the groups working in the lab. As it is, there is a lot of intrusion from other practitioners within the lab, and that was what I was trying to explain in my lecture earlier on.
Representative of the three groups made presentation afterwards.
The key point is that we actually need to come together to form a group. The first thing is to form a WhatsApp group where all of us will be involved. Then we need to decide on what type of business we want to run. Is it core pathology business? Do we need to add some imaging to it? But I think we actually want to start from core pathology business. Then the other thing is the framework. What type of framework do we want? Then the source for fund. How do we source for funds? Where do we source for our funds? So these are the basic things we discussed in this group.
We need to have an accrediting body working through MDCN. And we need to train assessors to be able to do this adequately. People who have the professional skill and expertise to be able to provide this assessment. There will be training over a period of 6 months, 3 sets of classes. They will come first for 1 week, then they return for 3 days, and then return again for 3 days. And once the assessors are trained, they would be eligible to provide assessment all over the country and even beyond the shores of Nigeria. So. Then the position statement that Dr. Lasuji talked about, the differences between the roles of the pathologist and the scientist, have to be clearly defined so that it's clear and they don't keep acting like they can do what the pathologist does. And as we do that, we need to demonstrate clear advantage over the scientists. So we have to be well poised to show that we actually can do something that they can't do. We have to be visible, we have to be present in the labs, and we have to show that we have something to offer.
The presentation of a position paper, first of all, on development of robust guidelines to clearly define the role of the pathologists. And it was suggested that we can adopt already existing guidelines after modification from the Royal College of Pathologists of Australasia, the Royal College of Pathologists of the United Kingdom, and the Indian Medical Society. The position paper will also include guidelines for laboratory practice in Nigeria. And also, there will be a revision. It's suggested that there will be a revision of previous position papers. The Lagos State government already has a position paper made to Lagos State government, so it will make the task easier if we revise that. And it was also considered that there might be an absorption of clinical scientists into CNP with clearly defined roles and responsibilities. And lastly, it was suggested that a dedicated team must be given this task.
With the provision of the right equipment, reduced brain drain, and enhanced remuneration, pathology practice in Nigeria will be more pleasurable.